We're here at eHealth 2012, and we're here with Sidna Tulledge-Scheitel. You're from Mayo Clinic. Could you explain what Mayo Clinic is?
Mayo Clinic is located in Rochester, Florida, and Arizona. It was initially started in the late 1800s, and we service patients that have very medically complex problems, as well as health and healthy living.
Okay, so in the US, clinics like this are mostly private, right?
Yes, for the most part they are. We're not-for-profit. All of the earnings that we do have, we invest back into practice and research.
Okay, now you're here at the eHealth conference. What is eHealth about Mayo Clinic?
eHealth? Well, eHealth is an active area, a focus for the Mayo Clinic, especially over the last 3 years, in that we're trying to provide more affordable access to Mayo Clinic knowledge.
Okay, and how do you do that?
Well, we do it through serving our patients, our established patients, and new patients through online internet that provides health information, and also a private logon portal that allows our patients to see their healthcare record and to communicate with their healthcare team. We also have a provider portal that allows physicians to have the ability to refer a patient to Mayo Clinic, to see the results of that referral, and also for physicians to ask a consultation, which we call an asynchronous e-consult, from the clinicians at Mayo Clinic as well.
Okay, so is it more like an administrative solution, or do you think it helps making better decision and diagnostics, etc.?
Well, we believe that it helps support the care of patients with the very specialty expertise that Mayo Clinic has, but we see that it's more efficient. We don't necessarily see this as a technology revolution as much as a service revolution.
Okay. What was your biggest learning during the last period?
Well, the biggest learning is, first of all, of course, you need to have IT partners to be efficient, to get these up and running, so that you can really spend your time focusing on the content and the services you want to provide. That this isn't just about flipping the switch, that you have to bring along culture, that you need to have leadership support, that you need to have the right measurements and incentives aligned. And this has occurred for us both externally, through some of the different programs that the government is offering, and also external publication of our results that has really caught the attention of our internal leadership to support these activities at Mayo.
Okay, and how did you find the right IT partners?
Well, that's always a challenge, and it's really an evolving issue as well. We really look for someone that has the quality that Mayo is looking for in our service. The Mayo experience is a very high-level experience if you come on site for care, and we want to be able to reproduce that same high level of excellence externally.
Okay, so what are your plans for next year? What is your biggest improvement you're hoping for?
Well, we're actually hoping to provide more interactive services to our patients. So we're going deeper into all of our practices. We started with primary care ability to have messaging with patients. We've spread now to principal care areas in the medical area, and we're spreading to surgical. For our referring physicians, we're hoping to spread our capabilities and different business arrangements with clinics through the Mayo Clinic Care Network, mostly domestic to date. We're trying to have an arrangement with 20 institutions by the end of this year, mostly domestic, but we will be spreading to international as well.
And what kind of interaction are you, what would be like an aim for your doctors, for instance, to establish? Would patients come less often to the clinic? Is that?
Well, we want to be able to provide ongoing connection and communication and support of patients and physicians without having them necessarily come on site. So we want to really satisfy our established patients, that they have an ongoing relationship with Mayo Clinic. At the same time, we want to be able to provide access to new patients that really have a need for the primary expertise that is needed to come on campus.
Okay. Now you talked about Obama, who's about to give penalties to healthcare institutions that don't share data. Could you tell something about that?
Yes. Back in 2009, there was a program called Meaningful Use, which was a part of the stimulation package that has prompted many institutions to embrace these types of technologies. Currently, there are certain milestones we need to reach in order to receive a bonus payment. But if you don't meet those milestones, going out, I believe 2015, 2016, all of a sudden those bonus payments for not having that functionality are going to turn into penalties.
Okay, and so what is the biggest challenge there then? Is that the standardization of data or?
Well, for instance, the ability to secure message, a care team, one of the measurements is that you have to have, they have something called eligible providers. So 5% of the patients seen by an eligible provider, primary care provider, principal care provider, need to be communicating, 5% of them need to communicate through the electronic digital environment. So this requires that not that you just get the functionality up, but that you have made your patient population aware of this functionality and that they're starting to use it as well.
Okay.
So the communication of these efforts is critically important, as well as bringing along the staff and the culture to be open to accepting these types of communications.
Now here in the Netherlands, there's a lot to do about privacy of that data. What do you think about that?
Well, of course, privacy and security are always top of mind, especially for the Mayo Clinic. And we have reviewed our IT partners, their solutions. This is always something that we discern very carefully, and we're confident that it's safe as it can be. We believe that it's safer oftentimes than maybe other paper, like mailing somebody's record to their home, a digital environment.
Yeah, so it's safer than having paper somewhere in the office.
I think so, but that's maybe my bias.
Yeah, okay. Well, thank you very much. Good luck.
Thank you.